Hi, good afternoon, Tony. My name is Mihiraa. I'm your invigilator for the OET-speaking session on the 6th of July 2021. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Tony Richard.
And what is your candidate number, please?
My candidate number is 261345513.
Thank you. And you are taking this test as a nurse? Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
Thank you. So let's start with warm-up questions. The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
That's all right.
Describe a time when you were particularly proud of your healthcare team.
Working in the ICU setting, there are countless moments that make me proud to be a nurse and proud to be part of this amazing community. Watching a patient survive a code, take their first steps on prosthetic legs, are some of the moments we all want to be a part of. Even if I am not delivering the news or care personally, the information directly affects me.
What approach do you take in communicating with people who do not know medical jargon?
It is imperative that we use simple words for our patients and families who are not medically trained, and utilize a teach-back method to ensure they understand the information that is communicated to them. I once had to explain post-operative care to a family whose child had tonsil surgery. I had to use words such as poop instead of bowel movement. I used Tylenol instead of acetaminophen.
Tell me about a time you were under a lot of pressure.
I was the most senior nurse in the unit by over a decade. I had to not only handle my patient assignment, but also was to act as a resource to the other newer nurses on the unit. I had to make sure my time management was great, as well as my ability to drop everything and help someone else. I had to stay organized, otherwise, I would not have been able to assist others.
Describe a time you provided effective patient or family education.
I use a teach-back method that allows nurses to know if families truly understood the information that was given to them. It is also important to provide the family with written educational material and use other forms of education such as videos or hands-on when possible. I taught a family post-operative spine care after a posterior spinal fusion. The parents were able to properly demonstrate how to transfer their child from the bed to the chair. In doing so, I was able to determine that they had retained the information.
Tell me about a time when you didn't know the answer to something at work. How did you go about finding the information?
As nurses, there is no way that we possibly can know everything. Knowing where to go for help is the first step. At the beginning of every shift, I identify a nurse that I can use as a resource, such as a charge nurse, nurse educator, or unit resource nurse. This individual is generally someone that is more senior with an advanced skill set. If I am unable to get an answer from them, or they are busy, I look at the healthcare system's policy and procedure manager. If there is a concern regarding a medication dosage or interaction, I look to LexiComp.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when the 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role-playing card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your OET-speaking roleplay. Don't worry if I stop you when the time is up.
Good afternoon. My name is Tony Richard. I am the triage nurse working in the emergency department.
Good afternoon, nurse.
Can you please tell me your name and age for the documentation?
My name is Mihiraa, and I am 68 years old.
All right, Mihiraa. May I know the reason for your visit to the emergency department?
Well, nurse, I am really bothered that I have taken an overdose of some of my medications. I feel uncomfortable now and worried about that.
Don't be afraid, Mihiraa. Coming to the emergency department and seeking medical support was the right decision you have taken. Definitely, we will take care of you. And Mihiraa, I would like to know about your medication details, please.
I have been prescribed NSAIDs for osteoarthritis. I am on several other medications as well. Also, I have no clear idea about my other medications. Importantly, I am not sure about the medication that I took in excess, as I am having forgetfulness.
It's okay, I can understand your situation. And, do you remember the number of tablets you took?
No, nurse. I don't remember exactly.
No worries, don't be stressed, stay calm. Now, can you explain the symptoms you experience after the consumption?
After the intake, I vomited once and started to have a stomach ache.
I am sorry to hear that, Mihiraa. Did you notice the presence of blood in the vomit?
No, there was no presence of blood in the vomit.
Was there any bleeding from gums or nostrils?
No, nothing.
All right. And have you suffered any respiratory problems?
No, I didn't experience any other symptoms.
That's good to hear, Mihiraa. Nothing to be alarmed of, as of now. However, you need to undergo several tests in order to identify the reason for the symptoms. For that purpose, we need to carry out tests, such as liver function, stool culture, etc.
Okay.
So, Mihiraa, let me explain the next steps involved in your treatment. We begin with the tests, and afterwards, you will be examined by a doctor. Alongside this, you will also require a certain period of monitoring.
Yes, I hear what you said. But nurse, can you tell me about my condition? What is wrong with me?
Mihiraa, I can sense your curiosity. I am sorry to say that it is not part of my job role to make any diagnosis. After the tests and consultation, the doctor will let you know in detail about your condition.
Oh, I see.
For your better understanding, I will explain the purpose of my role and triage. By doing the triage, it allows us to assess the seriousness of a patient's case, and thus, we can decide on the appropriate actions needed. Mihiraa, please be patient, and I can assure you that you will be examined by a doctor soon, according to the priority of the cases.
All right, I got it. Perhaps I need some medication at the earliest to get rid of nausea and this bad stomach ache.
Your situation is understandable, Mihiraa. Try not to worry. Meanwhile, you wait for your turn to see the doctor. Let me discuss with the doctor about your situation, and I will try to get antiemetic medication for you. An antiemetic is a drug that is effective against vomiting and nausea. Antiemetics are typically used to treat the side effects of various treatments and medications.
All right, can you please make it fast?
Sure, Mihiraa. Well, can I have your consent for the tests, please?
Here it is. You may please proceed.
Thank you for your consent, Mihiraa. Please take your seat, and kindly wait for your name to be called to initiate tests.
Okay. Sure, I will.
Thank you for your cooperation, Mihiraa. I wish you a speedy recovery.
Thank you. That is the end of your OET-speaking roleplay. All the best.
Thank you.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.